Good afternoon, Harvey Holland. I am Mihiraa. Let's start the warm-up session. Introduce yourself.
Greetings. I'm Dr. Harvey Holland. With a decade of experience in the medical field, I specialize in accident and emergency medicine. My expertise lies in handling critical cases and providing swift, effective care to patients in urgent situations. Additionally, I've led numerous medical teams and initiatives aimed at improving emergency response protocols and patient outcomes.
What is your medical experience like?
I've been a doctor since 2010, initially spending 4 years in the ICU, where I managed critically ill patients and honed my skills in advanced medical procedures. For the past 6 years, I've worked in the accident and emergency department, handling a wide range of medical emergencies. This role has sharpened my ability to make quick decisions and provide compassionate care under pressure.
What are the current trends in your profession?
In my profession as a doctor, several trends are prominent. Telemedicine has seen a surge in allowing remote consultations. Personalized medicine is gaining ground, tailoring treatments to individual patients. Preventive care and wellness promotion are increasingly prioritized. Advancements in technology, like AI and wearables, are reshaping diagnostics and treatment approaches. Keeping up with these trends is essential for providing optimal patient care.
What are the different roles of a doctor?
As doctors, we wear many hats beyond treating illness. We diagnose and treat, educate patients on their health, advocate for their well-being, contribute to medical research, and promote preventive care. Our role is multifaceted, encompassing not just healing but also empowering, advocating, and advancing the health of individuals and communities alike.
What advice do you have for aspiring doctors?
Drawing from my experience as a doctor, I have several pieces of advice for upcoming doctors. Firstly, I encourage them to cultivate a genuine love for their profession. Passion for their work empowers doctors to fulfill their responsibilities efficiently and without complaint. Additionally, dedication to their profession and adherence to professional standards are crucial. Upholding medical ethics is essential in all circumstances. These are just a few pieces of advice that I offer to future doctors.
You can now start your OET-speaking roleplay.
Good morning, Mihiraa. How are you feeling today?
I'm quite anxious, Dr. Holland. I've been worried about the results.
I understand, Mihiraa. It's completely normal to feel anxious while waiting for results. Before we go over them, I want you to know that I'm here to support you, and we will take this one step at a time. The results of your colonoscopy have come back, and I need to share some difficult news with you. I want you to know that no matter what I say, there are effective treatments available, and we will work together to address this. The colonoscopy revealed a 2 centimeters tumor in the descending colon, and the biopsy confirms that it is cancerous. I know this is very hard to hear, but there are some positives we can focus on. The tumor is confined to the bowel wall and hasn't spread to other parts of the body. This is crucial and means we caught it early. Given this, the best course of action is to urgently refer you to a surgeon. The next step is to discuss surgical options to remove the tumor. Surgery is likely to be very effective, especially since the cancer is localized. Please remember that you are not alone in this. We are here to support you every step of the way, and we will ensure you receive the best possible care. We will get through this together.
What? Cancer? I can't believe this. How am I going to manage this?
I understand, Mihiraa. This news can be incredibly overwhelming, and it's natural to feel shocked and uncertain about what comes next. While surgery is often the primary treatment for this type of cancer, it's important to be aware that there may be additional steps in managing the illness. After surgery, depending on various factors including the extent of the tumor and your overall health, we may discuss the possibility of chemotherapy or radiotherapy.
All right. Doctor, my concern is that my aunt died 5 years ago from bowel cancer. I saw her suffer so much during chemotherapy. That's why I don't want to go through that.
I'm sorry to hear about your Aunt Mihiraa. Treatment plans are very individualized. While chemo and radiotherapy are potential treatments, they are not the only options and are used based on the extent of the disease and your preferences. We can discuss all your options thoroughly before making any decisions. I want to emphasize that any decision regarding further treatment will be made collaboratively, with your consent and full understanding of the potential benefits and risks. Your well-being and comfort throughout this process are our top priorities, and we will support you in exploring all available options and making informed choices that align with your preferences and goals.
Okay. I'm also concerned about the surgery. Will I need a colostomy? I don't think I could cope with having a stoma and bag.
I completely understand your concern, Mihiraa. The thought of undergoing surgery can be quite daunting, especially when considering potential changes to your body afterward. In your case, given that the tumor is confined to the descending colon, the likelihood of needing a colostomy is actually quite low. In most cases like yours, where the tumor is located in this specific area, surgeons can often perform the necessary procedures without the need for a permanent stoma and bag. Of course, every situation is unique, and we'll need to discuss your specific surgical plan in more detail with the surgeon. However, I want to reassure you that minimizing any impact on your quality of life is always a priority, and we will do everything we can to ensure your comfort and well-being throughout this process.
That's a bit of a relief. But will the surgery cure the cancer?
It's understandable to have concerns about the effectiveness of the surgery, Mihiraa. Facing cancer can be incredibly overwhelming, and wondering about the outcome of treatment is natural. I want to offer some reassurance. The primary goal of the surgery is to remove the cancerous tumor completely. In cases like yours, where the tumor is limited to the bowel wall and hasn't spread further, the success rates of surgery are generally quite high. Additionally, the fact that we caught the cancer at an early stage, thanks to your proactive approach to seeking medical attention, is another positive indicator. The biopsy results suggest that the cancer is localized, which improves the chances of a successful outcome from surgery. While no treatment can guarantee a cure, it's important to approach this with optimism. We'll continue to monitor your progress closely and provide you with the support and care you need every step of the way. Together, we'll do everything we can to fight this and achieve the best possible outcome.
Okay, Dr. Holland. I'll see the surgeon. Thank you for explaining everything.
You're welcome, Mihiraa. We're here to support you through this, and we'll take it step by step. If you have any other questions or need further support, please don't hesitate to reach out.